Imagine being seriously injured, deep in pain, with no hospitals, no doctors, and no modern tools, no anesthesia. No scalpels, just the forest, fire, and the steady hands of someone who learned through experience, not textbooks. It may sound terrifying today, but for thousands of years, this was how people survived. They performed surgery with no tools, at least not the kind we know today, and somehow, it worked. It's me. Welcome to the Forgotten Path, where we explore how people lived, healed, and thrived long before modern life began. Today, we're going deep into the ancient world of surgery, where healing happened with nature, instinct, and courage. Before we go further, don't forget to subscribe and hit the bell icon. If you're fascinated by forgotten skills, survival, and ancient knowledge, this channel is your home. Now let's begin. Have you ever marveled at how incredibly advanced our medical technology has become? From sophisticated imaging techniques to minimally invasive procedures, modern medicine seems almost magical. But have you ever stopped to wonder how this all began? How did we get to the point of such advancement? Let's take a journey back in time and discover the fascinating origins of medical science. The story of medicine is deeply intertwined with the story of humanity. Our earliest ancestors, like many living species, instinctively licked their wounds, a basic form of first aid that helped them survive. As time went on, they learned to control bleeding by applying pressure, a tactic still taught to first aiders today. But what about when the wound ran deeper? Ancient cultures across the globe faced this challenge, independently inventing tools and techniques to address it. In places like Peru and Africa, evidence has been found of a process called trepanation, which involved drilling a hole into the skull. This was not an easy procedure. It required a strong, sharp tool to pierce the tough outer layer of the skull and make a clean hole in the inner surface. These early surgeons must have used tools made from sharp rocks or animal bones to carefully carve out a section of the skull. But why would they do such a thing? It's thought that trepanation was often used to treat injuries where the brain had been compromised. Imagine a time before ambulances, before neurosurgeons, before any of the modern medical interventions we rely on today. If you were to fall and crack your head open, your only hope for survival might be this procedure. By drilling a hole into your skull, the ancient surgeon could relieve the pressure that was building up inside your head due to the injury. While it might seem like an extreme measure, especially given the lack of anesthesia, this practice actually gave many patients a chance at survival. In fact, some of the skulls that have been discovered show signs of healing around the trepanned area, meaning that the procedure worked. The person survived. Surgery was not the only medical procedure that people performed without the benefit of modern tools. Fractures were another common problem that needed to be addressed. A broken bone left untreated can lead to permanent disability. So it's not surprising that ancient cultures developed ways to set broken bones without the help of sophisticated medical equipment. But how could they set a broken bone without metal pins, wires, or even X-ray technology? Well, it turns out that a lot of the principles behind traditional medical treatment are still used today. To set a broken bone, the first step was always the same. They had to realign the broken ends of the bone so that they could heal properly. This was not an easy task, since setting a bone by hand is quite delicate and requires a lot of precision. Once the bone was in the right position, it then had to be immobilized so that it could heal properly. In the absence of modern medical equipment, ancient healers used splints and bandages to keep the bone in place. Splints are rigid devices that are placed along the length of a broken bone to keep it from moving. They can be made from a variety of materials, including wood or metal. In ancient times, wood was probably the most common material used for splints, since it was readily available and could be easily shaped to fit the contours of the body. But how did they secure these splints and bandages in place? Without modern adhesives or medical tape, ancient healers had to rely on a combination of natural fibers and organic materials to hold everything together. Vines, leaves, and strips of leather were probably the most commonly used materials for this purpose. Once the splint was in place, the next step was to cover it with something soft to protect the skin from rubbing against the hard wood. Animal skins, leaves, or moss were all good options for this. To make sure that everything stayed in place, ancient healers would often use a type of paste made from tree sap, flour, or animal fat to hold the bandages and organic materials in place. While this might sound like a pretty primitive form of medical care, it was actually very similar to the way that broken bones were treated for centuries in many parts of the world. Even today, there are many remote communities that rely on traditional methods to set broken bones. But what if the broken bone was in a more delicate area, like the arm or the leg? In these cases, ancient healers would use a different technique to immobilize the bone. They would make a type of brace that could be worn around the limb. This brace would be made from wood or leather and would have two pieces that would be tied together around the limb, one above the break and one below. This would help to keep the broken bone in place while it healed. What about when cuts or wounds needed to be cleaned? After all, infection could be just as dangerous as an untreated fracture. Cleaning wounds without the benefits of modern antiseptics and sterile equipment was a risky proposition. But ancient healers had a few tricks up their sleeves to keep infections at bay. The first step in cleaning a wound was to rinse it out with water. This would help to remove any dirt or debris that had gotten into the cut. But rinsing alone wouldn't be enough to prevent infection. For that, ancient healers would use a type of herbal solution. Different cultures used different herbs, but the general idea was the same. The herbs would be boiled in water, and then the liquid would be strained and used as a type of antiseptic. This herbal solution would help to kill any bacteria that had entered the wound and prevent it from becoming infected. But what about pain? Wouldn't those undergoing surgery need some sort of anesthesia to dull the pain? Surprisingly, many of the same herbs used for cleaning wounds were also used for pain relief. For example, opium poppies contain a substance called morphine, which is still used today as a powerful painkiller. Willow bark contains a compound called salicin, which is similar to aspirin. These substances were probably not used intentionally for their pain-killing effects, but it's likely that those undergoing surgery would have felt some relief as a result. Despite the risks and the discomfort involved, the ancient practice of surgery was surprisingly effective in many cases. And it played a vital role in helping people to survive injuries that would otherwise be fatal. As you can see, ancient people were incredibly resourceful and skilled. When it came to performing surgery and other medical procedures, they didn't have the benefit of modern technology, but they were able to develop techniques that were not only effective, but are still used today. But how did they acquire these skills? Did they have a formal education system like we do today? Or were these techniques passed down through word of mouth? The answer is a bit of both. Ancient medical practitioners did not attend medical school in the modern sense, but they did undergo a type of apprenticeship. They would learn from more experienced practitioners, observing and assisting them during surgeries and other medical procedures. This apprenticeship system allowed them to gradually build up their skills and knowledge until they were able to perform surgeries on their own. It was also common for medical knowledge to be passed down through families. This meant that many of the most skilled surgeons were men and women who had been practicing medicine for generations. The downside of this system was that medical knowledge could be difficult to preserve. If a skilled surgeon died, all of the knowledge that he or she had acquired over a lifetime could be lost. However, some cultures were able to develop more formal systems for passing down medical knowledge, such as the Egyptians. The Egyptians kept detailed records of medical procedures and even had a type of medical school. Even today, there are many cultures that rely on traditional medical practices to treat illness and injuries. In some cases, these practices are used in addition to Western medicine, while in other cases, they are the primary form of healthcare. Traditional medical practices are often passed down through families or communities, and they can be incredibly effective. Many of the treatments used in traditional medicine have been shown to be effective in treating certain conditions. For example, acupuncture, which originated in China thousands of years ago, is now used around the world to treat pain and other conditions. We have covered a lot of ground here, from trepanation to the transmission of medical knowledge. We have seen that ancient people were able to perform complex medical procedures without the benefit of modern technology. They were able to do this through a combination of observation, trial and error, and the preservation of knowledge through storytelling and apprenticeship. If you have enjoyed this video and want to learn more about how medical science began, check out some of our other videos on the channel. And if you haven't already subscribed, please do so today. With your support, we can continue to bring you fascinating content about the amazing world of medical science. Thanks for watching.